Welcome to British BioMedicine Institute. Today I, Dr. Pramod Khatri, is going to represent a simple topic on musculoskeletal system. So basically, the structure and the functions of the muscles are, they helps in forming the body framework, and they also helps in protection of internal organs. They also enable body movement. And they are basically consist of bones, joints, and muscles. So the bones are composed of osseous tissue, and they consist of rich supply of blood vessels and nerves. And osteoblasts are the bone-forming cells, whereas osteoclasts are responsible for reabsorption of dead bone tissue. Bone cells are called as osteocytes. So the development of osteocytes and hardening process is known as ossifications, and the ossification process basically depends upon your calcium, phosphorus, and vitamin D. The adult skeleton has 206 bones, and they are basically categorized upon long bones like femur, short bones like wrist bone, and flat bone like skull. Irregular bones consist of vertebrae, and sesamoid bone consists of your kneecap. So the parts of the long bone are basically, there is a large shaft which is the longest portion, and it is also known as diaphysis. The end is known as epiphysis. The space between epiphysis and diaphysis is known as metaphysis. So the parts of the long bone consist of articular cartilage, which is a thin flexible substance which provide protection to movable points. The medullary cavity contains yellow bone marrow. The red bone marrow is found in infant bones and the flat bone of adults. So the cranial bones, they basically consist of your temporal bone, parietal bone, ethmoid bone, frontal bone, sphenoid bone, and occipital bone. The sinuses are the cavities which reduce the weight of the bone. So there are basically four sinuses like frontal sinuses, ethmoid sinuses, maxillary sinuses, and sphenoid sinuses. The facial bone consists of basically lacrimal bones, ethmoid bones, and nasal bones, along with zygomatic bones, maxillary bone, mandible, and palatine bone. Your spinal column consists of 5 sets of vertebrates. There are 7 cervical bones, 12 thoracic bones, 5 lumbar bones, 5 sacrum bones, and 1 coccyx bone. The bone of the chest consists of clavicle bone, scapula, sternum bone, and there are true ribs, false ribs, and floating ribs. The chest cavity is also known as thoracic cavity, whereas the bones of pelvic consist of ilium, ischium, pubic, and pelvic cavity. The pubic symphysis is where both pubic bone join together. The bone of extremities are, for upper arm there is a humerus, for lower arm there is ulna and radius, and the hand and finger consist of wrist, which are made up of carpals, palm are made up of metacarpals, and fingers are made up of phalanges. The upper arm consists of femur, lower leg consists of tibia, or also known as shin, and fibula. And for kneecap, there is a patella. The foot and toe consist of tarsal, calcaneus in heel part, metatarsals and phalanges. Joint articulation helps in moving slightly, like in amphiarthrosis, and if there is diarthrosis, then joints can move freely. And synarthrosis, there will be no movement or rigid bones are present. So now comes the tendon and ligaments. Tendons are band of fibrous tissue which connect bone to muscles, and ligament connect bone to other bones. Whereas synovial fluid, which is a joint lubricator, they helps in synovial joints in moving in an easier form. The movement occur at joints with assistance of muscles, tendons and ligaments. Muscle contracts or shortens and extends to provide body movement. The types of muscles are skeletal, which are voluntary, smooth and viscerals, which are involuntary, and cardiac muscles. Most muscles are covered by a band of connective tissue called fascia that support the muscles. So this is an exercise for you. Lift up your right forearm to flex your bicep brachii as if making a fist. Identify the origin and insertion attachment by agreeing with one of the following statements. The radius is origin, or scapula is the insertion, or scapula is the origin or radius is the insertion. Please provide your comments in our YouTube comment section box. So now comes the match the followings. So here ankle get matched with bend, arthur get matched with joint, brachii is your arm, and calcane is your heel. Carp is your wrist, and cephal is your head. Chondro is your cartilage. Ductile is your toe and finger, and kyph is your thumb. My is your muscles. My is your spinal cord or bone marrow. Pod is your foot. Osti is your bones, and phalanges are your toe bone and finger. Rachis is your spine. Scoli is your curved. Spondyle is your vertebrae. Ten is your tendon, and ul is your ulnar bone. So now comes the diagnostic, procedurals and laboratory test. Medical specialists that treat disorders of musculoskeletal systems are orthopedist, osteopath and rheumatologist, podiatrist and chiropractor. All these specialists, they treat various types of bone defect like your orthopedist, osteopath, podiatrist, chiropractor and rheumatologist. So basically we can carry out various examinations like for internal parts like your x-rays, scans and radiographers, which helps in identification of your bones and muscle ailments. Arthrography, arthroscopy, discography and CT, computer tomography, all these tests, they can help in identification of your bone injury or bone defect. Even also myelography and electromyogram and MRI. So the laboratory test measures the level of substance found in some of the musculoskeletal disorders. The common laboratory tests are rheumatoid factor test, CPK, creatinine phosphokinase, calcium, phosphorus, and uric acid. So if there is a disturbance or low level of calcium, phosphorus, uric acid, or rheumatoid or CPK, then it can affect your bones and joints. So other tests are also available like goniometer, which test for your Rome, and densitometer test your bone density. So there are various causes for musculoskeletal disorders. It can be due to injury, birth defect, systematic disorders, and degenerative disease. So there are various again types of fractures. If there is there can be complete fracture, incomplete fracture, comminuted fracture, green stick fracture, impacted fracture, callus fracture, or compound and simple fractures can happen depending upon the condition and injury. So now comes the pathology. The injury and trauma of the joints or muscles may cause a sprain. Overuse of muscles may cause strain. And the other conditions are tendinitis, dislocations. If you put excess pressure, then your muscles can get dislocated. They can break. Subluxation and osteoporosis. If some vitamin minerals are not present, then it can lead to weakening of bones and muscles, and that is known as osteoporosis. So if a patient is having pain or discomfort in their musculoskeletal system, they can take various medicines, and there are various diseases which get caused like osteoalgia, myalgia, arthralgia, arthritis, and tetany. These are the various diseases which get caused. So almost any major part of the musculoskeletal system can now be surgically repaired. We can use various supportive devices like traction, prosthetic devices, splint, and cast. They are helpful in repairing the musculoskeletal system. Reduction is the return of a part to its normal position, and osteoplasty will help in repairing of a bone. Tenotomy is the cutting into tendons to repair a muscles like myoplasty, and arthroplasty is the repair of your joints. Laminectomy is the removal of your spinal disc. So now comes the pharmacology. There are various medicines which are available to treat your musculoskeletal discomfort. So common medicines can be analgesic, steroids, muscle relaxants, and NSAIDs. So now I want to test your knowledge, and you can provide your comment in our YouTube section, please. Mr. Jones is concerned with the soft spot and she feel on her baby head. You realize the medical term for this soft spot is either fontanelles or fissures or foramen. So here the correct answer is fontanelles. Identify the axial or appendicular portion of the skeleton. So upper part is known as head and trunk, and middle part is known as your arm and legs. So here is our third question. Mary is complaining of headache, stuffy nose, and pressure with facial discomfort. Her physician tell her she has an allergy. Which of the following conditions might she be experiencing? Fracture of her vomer, sinusitis, and stroke. So here the correct answer is sinusitis, because these are a type of allergic reactions which are temporary, and if you take medicines, then they can be treated easily. So next question is, What are the medicines which helps in relieving your pain? For that, we can use analgesics, steroids, and muscle relaxants. So here, the answer is analgesics for relieving your pain. And in order to reduce your swelling, we have to use steroids. And if you want to reduce your stiffness, then you can use various muscle relaxant medicines. So I hope you have gained a lot of clinical information through this presentation. Please like, share, comment our YouTube channel named as British Biomedicine Institute. Good luck and goodbye.